Policy leaders in children's health care are calling on state lawmakers to protect kids from getting addicted to social media. That's one of several recommendations made today by the Child Fatality Task Force. WRAL Capitol Bureau Chief Laura Leslie joins us live now from the state legislative building with what else they're asking for. Laura.
Lena, the state's Child Fatality Task Force is made up of advocates and experts on children's health. They're asking state lawmakers to consider steps that the state can take to keep social media companies from using addictive algorithms that kids can get hooked on their platforms. The panel heard from UNC researchers today who have found that heavy social media use actually changes how teens' brains develop, making them more sensitive to social feedback from their peers. That change could last into adulthood. And they've also seen links between heavy social media use and sleep problems in teenagers. Some advocates want to ban Meta and TikTok from collecting user data on people under 18. They say without that data, the platform's algorithms won't be able to target kids as effectively as they do now. A bill that would have limited data collection for people under 18 was filed earlier this year, and it had a lot of bipartisan support, but it died in committee after a major lobbying push by social media companies.
The task force also made another recommendation about mental health today, Laura. More funding for school counselors. Didn't state lawmakers already do that this year?
They did, but not permanently. North Carolina schools, a lot of people know, are mostly far below national recommendations for the number of school nurses, counselors, psychologists, and social workers we're supposed to have. Well, over the past couple of years, state lawmakers have used federal COVID relief money to boost funding in those areas and create more positions. So that did improve slightly. But the federal funding that they used was one-time money, and it's going to run out at some point sooner than later. So the task force is asking state lawmakers to provide state dollars to keep those positions funded permanently. Advocates say research shows that having more of those support staff in schools can make a big difference when students are struggling with mental health, and it also helps teachers spend more time teaching. Lena?
We know we hear families asking for that of their schools as well. Laura reporting live for us at the state legislative building. Thank you.